Richard Dutton. Richard Dutton. Here? Yes. Yes, he says public option, why is it good? Well, it depends on what the public option looks like as to whether or not it's good or not. If it's constrained, it will in fact provide competition that I think will help bring healthcare costs down. If it's not constrained, it could be, you know, the monster that ate the city, you know, because it wouldn't be a fair playing field if it's not constrained. So, but a public option that is constrained is I think a viable option, not a mandate, not a requirement. It's not a takeover. And there's lots of places where the federal government provides services that the private sector competes.
Where?
Successful. They compete successfully. They, believe me, they are kicking profitability really well, competing against the government. So it happens.
So why isn't it all private?
Exactly.
Why isn't what all
Why
private?
isn't it all private then if they're doing really well?
Well, I think probably because many people here want to have a post office in a really small town that's not economically viable. It won't work. It won't work. I mean, we have a model at the post office. We decided that we were going to provide 6-day-a-week postal service to everybody in America, regardless of whether or not it was economically viable. Now, we're trying to close down some post offices now. You would think that we are proposing the end of the world as we know it. I mean, there are post offices literally that we're funding in communities that maybe are serving 50 people.
Give it to Walmart.
So that's and by the way, I mean, the same thing said the opposite. If the private sector is so good at this, how come costs keep going up? Why aren't the costs coming down?
Why go?
Allow
So, in most companies I name to you, they sell in every state.
Increase competition by reducing the government barriers to private competition.
And I think that's one of the things we're looking at in this bill to do that. And frankly, that's part of the equation that would be important if we're going to have this exchange. So there really are options.
So is your mind already made up?
My mind is, here's where I think I told you in my, first of all, this is not fair to people, okay? At the end, have people start shouting out. Let me just tell you where I am. I told you my 3 goals. My goals are to make sure that we do insurance reform so this woman is not having to wrestle a bear to get her bills paid for her breast cancer. The second thing is making sure that every American has choices and quality health care, and that the doctor and the patient are making decisions and not a bureaucrat in an insurance office or in the government. And third, that we bring down costs so that we can manage the deficit going forward for our children. As bills are proposed and come out, and as bills start moving to the Senate, if you'll go on my website, which I hope you guys all do, I will try to be as specific as I possibly can about what bills I like, what I don't like, why I would vote yes, why I would vote no. And I can't tell you right now whether I'll vote yes or no, because I honestly don't know what's in there. I mean, if they start taxing people that make, you know, the middle class America to pay for something, I'm not going to vote for that.
Is public opinion going to have
Listen, let me tell you something about public opinion. There is a huge majority of Missourians that want us to do health insurance reform for pre-existing conditions and all of that, okay? There is a huge percentage that want us to do something about the costs of health care as it relates to our deficit and the growing deficit in relation to the entitlement program in Medicare. There is a huge group that agree that patients need to have choices, and we need to continue to be able to get quality health care with the doctor and the patient in control. So most of Missouri agrees with my 3 principles. And I just, if you ask the question in Missouri, whether or not if you just say out there, I'm not sure anybody really knows what Obama's plan is versus no plan, you're going to get a pretty even split in Missouri. You're going to get a pretty even split. And because the state generally is pretty divided. So I think that a lot of you feel very strongly against any kind of bill, and I appreciate your passion. I respect your opinions, and I was here to listen, and I think I heard you loud and clear. And I will work as hard as I can. And by the way, if I disappoint you, you've got an opportunity to fire me in 2020. Now, I got one more today, so I don't want to be late.
Will you vote for this bill, regardless of what's in it, as Mr. Obama is threatening to do. Brad got it through strictly with 60 votes.
First of all, I think I've answered the question. It depends on what's in the bill whether I vote for it or not. I've shown already my independence and voted differently than President Obama has voted on a number of things. So I'm not gonna do this, you guys. It's not fair to everyone. I don't think we're gonna do reconciliation. I don't think that will happen. And by the way, reconciliation won't even allow us to get to some of the things I want to get done in the bill because it's a very limited ability to do it. It won't even impact some of the things we're talking about with insurance reform. So I don't think that's a viable option. Some people may be talking about it. Well, Schumer represents New York. He certainly doesn't represent this area.
Thank you for coming.
Thank you guys very much.